Well, that's good.
Get everything straight there.
I'd like to welcome everybody to the February 2022 Pitt County Board of Health meeting. It's our first televised meeting of the year. We'll go ahead and call the meeting to order. And first, we'll hear any public comments. Seeing none, we'll move on to the minutes for January. They've been previously circulated to the board. Any additions or corrections from the board to the January minutes? All right, seeing none, we'll look for a motion to approve the minutes.
So moved.
Second.
Any opposed? January minutes pass. And we'll move right into our fiscal report with Ms. Marcia Hall.
Hello, good evening.
Good evening.
We are looking at the end of January, which is period 7. We did not, there were no budget amendments the month of January, bringing our overall total approved budget to $16,557,629. Our year-to-date is looking very well. If you keep moving across our spreadsheet here, our actuals, we do have a little bit of a negative environmental health for the month of January at this time, which is understandable. We had a holiday. We do have a couple of vacancies and some positions that are still in the training process, and we also had snow on the ground in January, so that's understandable. That big number, that the actual, the $1.374, $656 in the negative, that is state funding that we have been approved, we've accepted, but we have not spent yet. So with state funding, you have to spend it before you get reimbursed for it. And at the end of all said and done, we do have $361,000, roughly, actually $362,000 encumbered. That is partly the Smile Safari, and overall year-to-date, we have a surplus of $1,491,000. So the end of January, we are okay. Are there any questions about January?
Questions or comments? You want us to go ahead and approve this?
You can. The grants, we had a little bit, if you wanted to move to grants too.
Okay, we'll do that. Good.
As well. The end of January, as you can see, Triple P is moving along. The other grants are just at various stages. We're fine in the grant area as well. The large number is due to the COVID-19 Regional Workforce Grant. But we will have the budget, I will present the budget to you next meeting. The departments are working through it. We've had a couple of meetings. We just got our agreement addendas from the state. So that will be your next month's meeting. So I look forward to having a really good discussion with y'all about that. So don't try to call out sick. I'm just picking. As far as positions go, it does look kind of bad, but we're re-advertising a lot. Some of the applicant pools, some positions we're not receiving any applications. Some we've interviewed, get to the offer stage, and it's just not working very well. We did have some resignations and just various different stages of positions. But yeah, we had 30 vacancies as of Monday of this past week.
Marcia, are you expecting any retirements upcoming?
The lady in red.
We won't talk about that.
I know. I do have another Carolyn on my team. I tried to not accept her letter today, actually. She worked with the state, and she came and worked with us for Jennifer, was it 5 years? We will definitely miss her as well, but she's in the business office, and yeah, so we've got 2 coming, and I might cry thinking about it, but I'm gonna hold it together right now since we're on TV.
Any other questions or comments for Marcia from the board? All right, we'll look for a motion to approve the fiscal report.
So move.
Second.
Any opposed? All right, fiscal report passes. Thank you, Marcia.
Thank you.
And next, we're gonna move into old business with our health priority selection with Amy.
You want me to?
Good, you can go ahead.
Dr. Hell, we just want to remind the board to vote, pick on their selections. The Survey Monkey tool is open. We've extended that through next Monday, through Valentine's Day, the 14th. So if you haven't voted, please go in and vote. We have a drop dead date. Second Monday in March, which we have to submit those to the state. So please vote on that so we can submit that final report to the state. And then we'll report back to you next month on that.
Great. All right, so I'll get that done, and then we'll be ready to roll for March. Next up, a market analysis with Mr. Mike Taylor.
Take this off so hopefully you can hear me.
Sure.
Good evening and
evening.
Happy New Year. First, well, it's not our first meeting, it's our first in-person meeting, as the chairman said. One of the things I want to touch on first before the market analysis that you noted with the positions, and Marcia mentioned it, and your perception of are there any other upcoming retirements. Pitt County is experiencing a number of retirements. It's somewhat unprecedented. That's probably the new word might be for 2022, unprecedented. I was talking with Florida Hardy, our Human Resources Director and Assistant Manager for People and Community, and one of the things that we're faced against is trying to attract and encourage people to apply for our vacancies. Not dissimilar than many other organizations. The Great Resignation is not a myth. It's a reality. I'll give you an example. Our small support department of 30, we have 6 vacancies. We're starting to make some headways in that, but I just wanted to kind of share with you, it's not solving the problem for the Board of Health or Public Health. It's just to say you're not in this alone. It's something that we're all facing. And we're hopeful that that we can come over this, but I'm believing that it's going to be other things we're going to have to do. Part of that is the market analysis that we're doing with the public health. And speaking with Dr. Silvernell, just want to make sure that that has not been forgotten. We've met with Dr. Silvernell, Dr. Hardy, and others in public health to make sure that what we're looking for is what we need. The survey tool was reviewed by several in public health. That went out last week. The consultant contract was confirmed in that scope of work. So just wanted to update you on that process. We had already mentioned that it would not be quick. I think Florida Hardy has been talking with Jennifer Dickerson about some things at the local level that we can do in the interim as far as being able to offer attractive starting salaries, while also recognizing we don't want to do harm to our current staff. That's part of the challenge. Any questions?
Once the consultants lined up, Mike, what's the timeline you were given on having information to bring back?
I would estimate that it's probably, you're expecting at least 30 to 45 days for results to get back. And then we'll have some way to measure at an aggregate level where we are. The other thing that I want to mention as well when meeting with Dr. Hardy and Dr. Silvernail, she's also on a statewide task force, if I'm remembering correctly, that's also trying to affect change at the state level. That is a big challenge at the local level because we're under the Office of State Human Resources. And that is not intended to be a cop-out. It's just a reality of where we are, and just kind of wanted to state that. So hopefully through some of her actions and others in the state, we can compel the Office of State Human Resources to really understand the size of the issue that we're being challenged with.
John, what are total position all-in numbers for public health? Is it 150 or?
If everybody was full?
Yep.
If every position was filled? Yeah, I think we'd be at 152 right now. So we've got 30 basically that are vacant because we thought we had 30. We hired somebody yesterday. We were at 29, but we had a position we were waiting for approval from the OSHR, and that took us from August until just this past week. We got the approval for that job description and that position, so that added one back in, so we were back to 30 vacancies. But if fully staffed, we'd be about 152.
And that's one of the things that Dr. Silvernail is describing. It's a lengthy process, unfortunately. And so those are the things that we're trying to accommodate and work through at the local level as much as we can.
Yeah, I will say Dr. Hardy reported some good news with the state. She's on the Institute of Medicine Task Force and another state task force. There has been some movement in changing the requirements for public health nursing to make it a little bit easier to hire new grads as public health nurse 1 and get them into the system. And hopefully if we can get a new nurse into the system, that person, you know, male or female, whatever, will stay with us and grow with us from PHN1 on up through the ranks. But we need to get them in the system first.
All right.
And if you could say otherwise, Dr. Silvernail and possibly even Jennifer, who does a lot of the human resources processing on the public health side. What I would say, what I believe we're going to find our major barrier is those minimum requirements from the Office of State Human Resources versus our ability to be competitive in salary. I'm not saying that's not part of this challenge. I believe our biggest challenge, and that's going to be the next step. We wanted to first start with our market survey, and we talked about that with Dr. Silvernail and Dr. Hardy and others. Start there with the market survey, but then not also putting in with our consultant perhaps processes that we could advocate towards the state of human resources for more changes that would be, I believe, more impactful for consideration of our applicants.
Yeah, I mean, it's multifaceted. You know, we've discussed this, you know, at length. We've got in a small pool to pick from. Of the pool, we're handcuffed because, you know, this applicant may not have the hours or the time in to even put an application in. And then, obviously, the pay scale. You know, I mean, we can't get people in here, and then we can't pay them once they're here. I mean, it's tough. I mean, I've seen this list grow in the past 12 months from 16 or 17 vacancies to 30 in 12 months, almost doubled, which is not good. 20% vacancies. Other questions for Mike?
I just want to express appreciation for the public health team and kind of working with us and trying to understand the problems and trying to make sure that we can bring back the information that this board can consider, as well as county management, in how to improve this situation.
Yeah. Thank you, Mike.
Thank you.
Yep. Thanks, Mike. Thanks for doing this on short notice. Mike kind of found out when the agenda came out that I'd asked him for an update, so short notice. But I didn't want it to slip off the agenda, and I thought that one of the board members might bring it up anyway, so
Yep.
felt it ought to be on there.
Good. Thanks again, Mike. Any items of new business? All right, hearing none, we'll move on to the health director's report with Dr. Silvernail.
Or my knees are getting old. All right. That full screen. Take my mask off. I can do that without breaking my glasses. Good evening, folks.
Good evening.
Good to be back with you. Tried to keep the agenda somewhat short tonight, give you a break for a change. Do want to review, and I've got some comments in my report about our workforce. 29 vacancies, we said today, and then Jennifer said, well, hey, well, we had 29, but I got this approval, so now we're back up to 30. We did hire a person yesterday, so that was good news. We obviously have more last days coming for Pitt County employees. We've got a retirement in the business office, as Marcia mentioned. We have one of our laboratorians who's leaving at the end of the month. Of course, Amy's retirement is looming out there on the end of next month. So I have at our general staff meeting on Friday, I did ask employees who were considering leaving the department or contemplating other opportunities to come see me. I told them that some things I can fix and some things I can't, but at least give me an opportunity to know why they're leaving before they leave. We have moved some employees around internally. In December, Lee Draper, a longtime immunizations program coordinator, retired, and we were lucky to have one of our nurses move internally. But so we filled Lee's position, but then we now have to find a nurse to backfill her position, to fill Kayla's position, so that we can put somebody back in nurse-family partnership. Stress levels are high in the health department staff, and people's fuses are short and our filters are thin, so we'll bear that in mind. Some of us, if we seem a little loose or a little rough around the edges. Move on and review our COVID-19 data with you. Sequencing, oops, hit the button on the side of that. Sequencing, good information, or good issue in the sequencing. Omicron really has driven Delta out of eastern North Carolina for the most part. Last week we were 99.3%. This week we're 98.8%. So there's about 1% of Delta that might still be lingering out there in the sampling, but the vast majority of COVID being sequenced through the Brody Vidant program is Omicron. Yes, we did have at least one BA2 variant identified in that sequencing program, but it's a subtype of Omicron, so still basically Omicron. And some people think the BA2 will come to be the dominant form of Omicron with time, but that's to be seen. This is a curve I've shown you frequently. It's our epidemic curve from the beginning of the pandemic through now. And you can see that was our first little spike. That was a rehab facility. Then we came up on our summer plateau, ECU spike, first wave of the original variant, or I believe was the alpha strain, the spring wave of that, our nadir low point the week of June 19th, and then Delta came through. And we came down, and we were riding a little bit of a plateau after the holidays with Delta, and then here's Omicron, and just shot off the chart. You can see where we were below 2,000 cases a week at the peak of the first wave, peak of the Delta wave, and here we approached 5,000 cases a week at the peak of Omicron, so a huge difference in number of cases. Good news is this report comes out every week. And you can see for the past 3 reports, we've dropped steadily. So that's beginning with the week of the 15th to the week of the 22nd to the week of the 29th. We've dropped steadily each week. And we're back down. Now there's still a lot of virus around. We're really back down to a level that's about the top of the Delta wave, just below the top of the Delta wave. And the other point, this is the graph for congregate living versus non-congregate living. We've seen some activity in congregate living, but it's so small that it doesn't show on the graph the way the graph is scaled. So I'm seeing some caseload in our congregate living centers, but but not serious disease, and we've incurred no deaths for about 2 months now. Now, deaths are a lagging indicator, and sometimes they need to be sorted out of other data before they get added to the system, and they usually come in clumps. So at some point, we probably will add another clump of deaths, but to date, we have not. Here's the same curve by race. And you see again, in the taller portions of the wave, we see a lot of folks that are this teal color, mint chocolate chip color, and they identify as other. That seems to line up fairly well with that 25 to 49-year-old age group when you look at it on an age basis. Whites or Caucasians are the sort of slate blue, African Americans are the red. Hispanics or Latinos are the purple or lavender color in the stack. We look at this by age. For those of you that may have have children in school or grandchildren in schools, when you look at the top of the yellow here, which are the 0 to 17-year-old age group, you can see that just amongst that age group, there were more cases in that age group than there were for everybody put together in the Delta wave. So very, very high levels initially, but that's fallen off very quickly in our schools as you look at this by age. The blue is the 18 to 24-year-old group, good chunk of that, and our college age students through the middle of this, and then falling off pretty quickly. The red group is that 25 to 49-year-old group, sort of the young, healthy working group. And you see that's been the biggest bar by age throughout the pandemic, but every age group is receding at this point, so that's good news again. This is our testing. A lot of interest in testing. Is there enough testing? You know, there's certainly we're long lines at times for testing. Testing is broadly available through the community. The Vidant site, the state vendor site at the mall. Most of the pharmacies are offering some testing. ArcPoint Labs, number of different places, many physicians' office, urgent care centers. So at the height of the Omicron wave, we did a little bit below 12,500 tests in a week. That's an enormous amount of testing, and this does not include home testing. We know there's a lot of folks that have been doing some home testing as well. The black line is percent positivity, and this has got us showing us in the high 20s. I thought we were still in the low 30s when I looked at it on the state website today, so that may have been an extrapolation. Vaccinations in the county. Here's our numbers in the county. For individuals who've received one dose, we've had a little over 101,000 individuals receive at least one dose of vaccine, or 56% of our Pitt County residents. For individuals who've received 2 doses of an mRNA vaccine or 1 dose of J&J, 94,500 and change, or 52% of Pitt County residents. So a pretty reasonable number there. And the red asterisks are 39,783 individuals with 1 booster, 1 additional dose. I keep hitting that mouse tonight. We are making progress with that, but uptake of boosters has been slower than most of us would have thought. When you look at this age stratified, we've seen in our 5 to 11-year-old age group, we're up to 20% of 5 to 11-year-olds have had this vaccine. In our 12 to 18-year-old age group, a little bit higher there. I want to say that was 44%. It was really impressive in that sort of the tweens and teens, how many individuals were vaccinated. We're actually lagging a little bit in the 18 to 24-year-old group, and then the other age groups go up steadily by age. I've tweaked my counterpart at the ECU Student Health and said, hey, we need to give some more shots over there for you. But we are lagging a little bit in that age group. We look at our operations. Vaccine demand has definitely declined. We've adjusted our clinics accordingly. We continue to provide the Moderna vaccine for those 18 and older. We continue to provide the Pfizer-BioNTech vaccine for ages 5 to 11. We've only done, I think, around 160 doses of that. It's relatively small. Many kids now have a medical home with a pediatrician and have gotten them there. The pharmacies have also done a fair amount of the 5 to 11-year-old market. Many of the pharmacies are given the shot for that age group, and they have done that. We will begin offering the Pfizer-BioNTech for ages 6 months through 4 years once it becomes available, and that's expected by early spring. Lots of talk about that. We've already had to agree to accept allocations, that kind of thing, so it's coming. We just don't have an exact start date for that. And then we did recently conduct a vaccine clinic at the Pitt County Detention Center for inmates over there. A couple days later, the jail medical service did obtain its vaccinator approval through the state and can now do their own vaccinations. So they will continue to do their vaccines themselves, and we will support them if we need to. Vaccine availability, it's available through the health department, through Vidant Health, through ECU physicians, through many private practices, and most chain pharmacies. And even the private pharmacies, there's a couple of private pharmacies still in the county, and I know of at least one of those that has vaccine available. One of the issues with the chain pharmacies and the 6-month to 4-year-old age group is that they can only do 3 years and up per their immunization agreement and the emergency youth authorization. So there's some concern that some of the kids on the younger side of that may have difficulty accessing vaccine. That's one of the reasons that we'll have it. We do routine childhood immunizations for kids that age, so we will make that part of our practice to do these the COVID vaccines for those who want it at the health department. But again, we expect that many of these children do have a medical home with a pediatrician or family doc, and we'll get it through their medical home as well. Want to just touch on some supply chain issues for you. There's a national shortage of anti-tuberculous medications. So right now we're treating active cases and recent converters that we have linked to an active case, just because we're not sure that we're going to have adequate medications to treat everyone. So we'll be deferring treatment of latent TB unless it's clearly linked to an active case. And then we had a brief interruption in our supply of Depo-Provera. I think we sent something out to the board on that just in case you all got a question about that. That has been rectified at this point, but it's day-to-day sometimes with supply issues. Our laboratory, we have issues with culture plates, specifically for GC, the chocolate agar plates. There's a limited supply of these. The ones that we normally use come from the state lab. So we get them in small batches, and they are short shelf-lived. That provides some potential limitation for testing there, although we do have a backup, what's called basically a PCR test, a nucleic acid amplification test for that. CDC tubes are in short supply. Butterfly needles are in short supply. I've heard we've also had trouble getting some lab coats, which is interesting as these things come up. Excuse me. As these things come up, I'll continue to brief you. We expect that other issues will manifest themselves, and again, we'll advise the board as they do come up. Excuse me. That's the end of my slides. I did, Angie Manning, my environmental health director, sent me a note of some accomplishments for environmental health after I'd already sent that report over, so I didn't get to put them into my report, Angie, but wanted to share some numbers with you, the workload that our environmental health division has done. This is across the division. Food and lodging have inspected 1,028 facilities and issued 92 permits for new eating establishments, both large and small. 69 plans for people who to open such establishments, and investigated 72 complaints about establishments. In return, 4,724 phone calls to people. In our children and swimming pool and tattoo, our staff member Tashonda Hill has inspected 117 child care centers and schools, made 27 educational visits, and made 6 construction visits for new centers, and reviewed 2 plans and had only 3 complaints, and answered 724 calls from citizens of Pitt County. One of our new staff members, Marion, has done 43 tattoo artist permittings and 21 swimming pools. In on-site wastewater, from July to January. A total of 811 permits have been issued. They've completed 2,500 plus field activities. They've declined only 12 permits in that time frame, and have visited 1,111 sites, all while being short-staffed. So we only hear about the complaints. We don't always hear about the good work that's going on, but environmental health has done a tremendous amount of work and should be recognized. I'll see that you get the email so you can read the totality of the email, and happy to take your questions if you have questions tonight.
John, did you say 42 tattoo places?
43, Dr. Garrison.
That, I mean, are those all unique? That's a lot of, so we have a lot of opportunity to get tattoos.
There's a whole lot of inking going on. You might want to get a new tattoo, Dr.
I
Garrison.
appreciate that.
If we've inspected it,
It'd be
it's
hard to
safe.
choose which one to go to. I know. They're all good.
Yeah, I wouldn't have thought there were that many, but there are. Younger, hipper community, I guess. I only have freckles. I have no freckles and scars, no tattoos.
Any other questions or comments for Dr. Silvernail? Thank you, Doc.
All right, thank you, folks.
All right, well, that gets us through our agenda here. Well, we'll all remember to do the survey that Amy sent out, and we'll have that ready to go about early next week for you. We'll look for a motion to adjourn.
So moved.
Second. Any opposed? All right, the meeting is adjourned. Thank you all. We'll see you next month.
Wow, that's really cool.
Okay.